Maharashtra University of Health Sciences, Nashik. I am Dr. Karli Gitanjali, Professor and Head, Ayush Department. And today we are going to discuss a neurological disorder, Wilson's disease. And to present this case, we have Dr. Mansi Kothekar. Then we have Dr. Ninad Thorat. He is consultant neurologist. Then we have Dr. Digambar Dipankar. He is from Ayurveda. Dr. Santosh Kumar Gite. He is from Homeopathic. So we will start with PG scholar, Dr. Mansi Kothekar. She is PG scholar from Vedanta Institute of Medical Sciences and Research Center, Palghar. So you have shared your screen, Mansi. Dr. Mansi, unmute yourself and share your screen. Okay. Yeah.
Hello.
Yeah, you are audible. Please start.
Yes.
Unmute yourself.
I have unmuted myself, ma'am.
Okay. Now start. And raise your voice.
Yes, ma'am. Can you see the screen, ma'am?
Yeah, we can see, but your voice is very low.
Okay.
Can you please
I'll
increase?
raise my voice. Yes, ma'am, I'll raise my voice. A very good afternoon to everybody present here. Today, I, Dr. Mansi Kothekar, JR2, resident of psychiatry from Vedanta Medical College, Dahanu. I'll be presenting a case of Wilson's disease. So, she was a 16-year-old tribal girl weighing 36 kgs, was brought to the casualty by parents with history of suicide attempt by hanging from a tree in an unconscious state. On arrival, her BP was 90 by 60 millimeters of mercury, pulse rate being 100 per minute, and she required an oxygen support of 2 liters via nasal cannula to maintain the saturation of 98%. She was hypoglycemic with an RBS of 76 mg per dl, and she was afebrile. So, the 16-year-old girl who was brought to the casualty, as mentioned earlier, with a history of suicide attempt by hanging from a tree. Once after she was stabilized in the casualty, she was referred to the psychiatry OPD for further evaluation. During the first interview, patient revealed that she attempted suicide impulsively as she could not handle the rejection from her boyfriend, with whom she had eloped 2 days earlier and was accompanied by two of his friends. On asking the details of the boyfriend, she suddenly pointed towards the ceiling of the ward and said that he's there. Further inquiries confirmed that the boyfriend and two other friends were in fact well-structured visual and auditory hallucinations that the patient was experiencing for the past 1 month. And they commanded her to die by hanging from the tree. Objective data from the parents revealed of seeing her muttering and laughing to self, gesturing in air, wandering aimlessly, and having suspicious gaze and scanning eyes, which was associated with her deteriorating academic performance, reduced social interaction, and disorganized behavior for the previous 1 month, which they had attributed to exam stress at the time. This led to a provisional diagnosis of brief psychotic disorder according to DSM 5. On physical examination, a ligature mark around her neck was found and a presence of golden brown ring at the periphery of her bilateral cornea was seen. Her mental status examination revealed her mood. She was uncooperative to express her mood with an restricted affect, retarded thinking, which was relevant and coherent. She had perceptual disturbances of visual hallucinations. She was seeing three unknown males who were clear and well structured images. She had auditory hallucinations. She heard clear voices of three males unknown who were commanding her to hang from the tree, and she could hear them throughout the day. She was not aware of her illness and her judgment was impaired. So, based on the clinical history and mental status examination, a preliminary diagnosis of brief psychotic disorder according to DSM 5 was made. On routine investigations, her ultrasonography abdomen revealed hepatosplenomegaly. Slit lamp examination showed the presence of Kaiser-Fisher ring. MRI brain showed T2 and flare hyperintensities in her bilateral thalami, and serum celluloplasmin levels were found to be significantly low, that were less than zero point 0.1 gram per liter. As you can see in the images above, there are hyperintensities in the T2 axial view of the MRI in her bilateral thalami, and the presence of a golden brown ring in her cornea, around her cornea. So, in the presenting case, the presence of hepatosplenomegaly, KF ring, psychotic symptoms in the form of commanding auditory hallucinations, and a decreased serum ceruloplasmin level confirmed the diagnosis of Wilson's disease. So, the psychiatric manifestations, especially the presenting complaints of the patient of suicide attempts secondary to psychosis that were commanding auditory hallucinations, is extremely rare. And so far, only one case report of suicide resulting from commanding hallucination has been found in South Korea in 2019 by Young and Lee. Thank you.
Thank you, Mansi. Good presentation. Now next to discuss this case, we have Dr. Ninath Thura. He is consultant neurologist. He is affiliated with many multi-speciality hospitals in Maharashtra and having academic experience also. Welcome, sir.
Yes, ma'am. Thank you for inviting me for this session. I'm glad I could share my views with you all. So, Wilson's basically is an inherited disorder, and it is an autosomal recessive disorder. I don't want to go into the basics of Wilson's because this is specifically, I think it is about the psychiatric symptoms that we see in Wilson's disorder. Correct me if I'm wrong, ma'am.
Yes, sir, it is.
Yeah. So, basically, Wilson's is seen around the age of, starts usually in the age group of 15, and it is seen up to the age of 30. That is the time period when the symptoms are seen. Psychiatric symptoms can start even in the early age before we get the liver symptoms, hepatic symptoms. And the first symptoms that we may see in children, consider the child is around 10 to 20 years, that is the age group. We may see a declining school performance. We may see sudden change in behavior in the form of impulsiveness, or we may see use of addictive substances in college-going people. So these things are not very uncommon. And I would definitely say that any sudden changes in behavior and personality in young patients should definitely be investigated for these kind of disorders. As ma'am said, these suicidal attempts which have happened in few patients, that they are extremely rare, especially formed hallucinations of these kind have never been heard of. Especially I have not heard of it in my education days or after I started my practice. But this is quite a good insight into this presentation that ma'am just did. Is quite a good insight into what can happen in a patient of Wilson's disease, which we should not miss out. We probably, that patient might have been treated just for some psychiatric disorder under stress or generalized anxiety or all those things. And we might not have even found out that she has some kind of disease of such sort. Other psychiatric symptoms that we see in these patients are depression and anxiety or bipolar disorder. And cognitive changes are seen in these patients. Cognitive changes can be in the form of slowing of mentation, poor calculations, difficulty handling finances, and quite a lot of these things. Hypomania is one thing that is seen in these patients over a period of time. So by the time the patient develops hepatic symptoms, they already have some kind of psychiatric changes that might be seen. if investigated properly by a psychiatrist. Yeah. So if the others want to put in something, I'll be happy to hear.
Sir, what are probable etiological factors for Wilson's disease or this case?
Wilson's is a inherited disorder. It is autosomal recessive disorder. There is a gene ATP7B which is mutated in these patients, and it codes for a protein which is copper binding protein. It is you seen in the Golgi apparatus of the brain, the cornea of the eye, and the liver. So that's why this deposition and the symptoms are more seen in the brain and the liver. That's why it is called hepatolenticular degeneration. So this gene is defective, and it produces a defective protein, and this protein is not able to bind the copper, and it keeps on depositing in the liver. Usually, daily we consume around 1 to 2 milligrams of copper. In the diet, we have that much of copper, and out of that, around 0.75 to zero point 0.8 milligram, the body keeps. The other thing is put out of the body. And when these proteins don't work, the protein apoceruloplasmin, we call it. When it doesn't work, then the copper starts depositing in the liver. More copper is formed, it gets deposited in the basal ganglia and the thalami of the brain. And these causes the Parkinsonian symptom, the psychiatric symptoms. But the etiology is basically genetic.
Okay, so it is different from Indian childhood cirrhosis.
Yeah.
Then another question is what can be investigation tools for?
Right. So any patient who comes to you with a history of hepatitis or jaundice, any kind of symptoms related to the liver, and it is a young patient who also has some kind of psychiatric or neurological symptoms. Neurological symptoms can be in the form of chorea, tremors, then Parkinsonian gait, slowing of gait, and drooling of saliva. So these patients should be first investigated for serum ceruloplasmin, serum copper, urinary 24-hour copper. Then we can do the gold standard diagnosis by liver biopsy. So these are the things that needs to be investigated for, along with the USG of the abdomen. Genetic testing is required. In Indian setup, it is difficult to get genetic testing because it's quite expensive and we cannot do it for everyone. And Wilson's is usually seen in most of the tribal population.
Okay. And what about treatment part?
For the treatment, there is a chelation that we do, that is with D-penicillamine and zinc therapy. This chelation therapy gives very good results, and people have completely normal life if they have been diagnosed earlier. So basically, the chelation happens with the D-penicillamine binds copper and it sends it out of the system. Zinc therapy is another one which we use, and these together can give quite a good substantial amount of improvement in the patients. All this depends on what stage of disease the patient has been diagnosed at.
So early diagnosis, early treatment, right?
Yes. Yes.
Okay.
If the patient has already developed cirrhosis, then it is difficult to recover.
And is there any limitation to treat these patients? Is there any limitation?
Limitation in the form of
Means when we cannot treat such kind of patient.
right, I understand. So at a certain point, when there are already changes which are seen in the brain, usually the thalami or the basal ganglia, they are involved. And if the changes are quite widespread, and by the time the patient comes to us, the patient is already having a Parkinsonian gait, they are having severe tremors or hemivalism or chorea, and the patient's hepatic functions are quite deranged, then up to a certain limit we can change the outcome of the patient, but the neuropsychiatric symptoms, they usually never completely improve. So to tell you of a case, we had a girl around 13-year-old who was diagnosed, Now, I was in my MD when she was diagnosed, and she was recently. I got to know from one of my gastroenterology friends that she had visited him, and she still has some kind of impulsivity, sudden rage, or suddenly doing things which are not expected of her. So it has been 10-15 years now, but she has improved quite a lot. She has a good liver functions, everything is fine, but the psychiatric symptoms are still there. So there is no correlation between the hepatic functions and the neuropsychiatric issues. So they still might have issues later on with psychiatry and neurology, but they usually don't completely improve.
Okay. Sir, what do you think about in such kind of cases? Can we refer to Ayurveda or homeopathy?
Ma'am, I'm not against it, but I have very less knowledge about alternative medicine in these patients. See, these we already have D-penicillamine and the zinc therapy, but any sort of treatment that is going to be additional, effect or additional help to the patient. There is no restricting it. So what we call as a comprehensive treatment of alternative therapy plus allopathy, definitely there is no what do you say? There is no harm in giving it if it is going to help. I will have to read it definitely. I'll go through
To
if you have
discuss
any articles.
kind of treatment. Yes, sir. Thank you so much for your detailed explanation about this disease. Please stay with us. We
No
have
problem.
Dr. Digambar Dipankar from Ayurveda. He is professor of Kai Chikitsa department from D.Y. Patil Ayurveda College, Pune, and he is having more than 20 years experience in academics.
Superb.
So, Dr.
I would
Dipankar,
love to hear. I would love to hear.
yes, sir.
So, thank you, Dr. Carle, ma'am, for inviting me. And it is a great concept to put all together allopathy, Ayurveda, and homeopathy for the discussion. So, I think little bit Ayurveda is little bit understand. It is difficult to understand for all the allopathic persons. So, better way I would like to share my PPTs if
Okay,
is it possible.
yes, please share.
Okay. Okay. Yes. Yes. So,
Your PPTs are visible, sir.
yes. Thank you, ma'am. So, so approach of Ayurveda finding related to underlying etiology, diagnostic method as per Ayurveda, line of treatment and limitations of Ayurveda. So I want to discuss these four headings as per my I received later. So underlying etiology according to Ayurveda is Agni Mandya. What is meant by Agni Mandya? Agni Mandya is improper digestion, and it is mentioned for almost all the disease by all our acharyas in the textbook. So if your digestion is not proper, then what you are eating, it will uh, cause you the disease. This is the main thing. Also, as it is a genetic disorders, Ayurveda is mentioned prenatal care, especially for all the pregnant women. And if the patient is a carrier of Wilson's disease, and if she is not following prenatal care mentioned in Ayurveda, then there are more chances that the patient, the offspring will have a Wilson's disease. Another thing is not taking diet and medicines in the prenatal stage mentioned in Ayurveda. So Ayurveda mentioned different diet for every month, different medicines for the every month, and so that we can have a proper 9 month proper pregnancy and a good offspring, healthy offspring without any congenital disorder. This is the main theme of the prenatal care according to Ayurveda. So if the patient is carrier of Wilson's disease or the carrying the mutated genes, then if she follows the prenatal care mentioned in the Ayurveda, then there are less chances of having the Wilson's disease in the offspring. Another thing is diagnostic method as per Ayurveda. Look, there is a no diagnostic methods mentioned for to diagnose the Wilson's disease. In fact, Wilson disease is not mentioned in Ayurveda, but we can understand according to the symptoms of any disease which is present in modern era. So we are diagnosing this case as per the clinical basis or on the symptomatic basis. So what is your Ayurvedic diagnosis? In Ayurveda, there is a disease called Unmada mentioned in Ayurveda. So what is the Unmada? Unmada covers a wide range of symptoms and it is synonymous to insanity, mania, mental derangement, mental disorders. Now we are discussing about the Wilson's disease with the presentation of neurological disorders. That's why we are correlating with this disease as a Unmada. And in this case, there is a deranged perception of all the sensory stimulus, loss of orientation of time, situation, hallucinations like this. So symptoms present in this case. So Unmada will be our diagnosis according to Ayurveda. Now the pathogenesis as per Ayurveda. In Ayurveda, there are three dosha mentioned like Vat, Pitta and Kapha. So visheshan of all the three doshas present in this case of neurological disorders related to the Wilson's disease. And also there are three mental disorders mentioned in Ayurveda. These are Raja, Tama and Sattva. So out of which two doshas are vitiated like Raj and Tama. And there are the doshas like a tissue, like Rasa, Rakta means the, you can say child and the blood are vitiated due to the accumulation of the copper and it is accumulated all over the body, especially in this case, it is accumulated in the brain. So, and the vitiated channel in Ayurveda, according to Ayurveda, may be Rasva Srotas and Raktava Srotas and Pranava Srotas. So these are the Ayurvedic terminologies and it is accumulated, the stage is accumulation stage and it is due to the reduced digestion capacity as per Ayurveda. Now, what are the principles of management according to Ayurveda? We are, if suppose we get this patient or such type of patients, then first we will do advise the patient to avoid etiological factors. Now, in this case, it is not possible to avoid the etiological factors, but this is the general principles of management in all the disorders. Second thing is improve the digestion capacity. So we are giving some medicines which improve the digestion capacity. Third, we will do the pacification of the increased dosha from the body as well as from the mind. And then the purification of tissue with the help of medicines as well as the panchakarma therapy. And another thing is excretion of waste product like copper from the body with the help of Ayurvedic medicines. Then what type of medicine is recommended according to Ayurveda? These are the some names I mentioned. The like Acacia catechu, Hemidismus indicus, Rubia cordifolia, Tribulus terrestris, Borevia diffusa, and Trichrozoa purua. So these are the some Ayurvedic medicines. We are taking these medicines, mixing together in the form of powder and we are making the decoction of 10 gram of these powders and giving in the dose of 40 ml in the morning, 40 ml in the evening on empty stomach. So what is the effect of these medicines? Some medicines will do the purifications of blood. Some medicine will cause the diuretic effect and wash out the copper. And some medicine will act on the brain and the liver, the sites where the copper is accumulated. So we are targeting three things. We are purifying the blood. We are removing the accumulated copper like in the soft organs as well as we are giving the diuretic medicine to wash out. Another thing is in initial stage, we can do the purification therapy like Virechan and Basti. Virechan means the medicated purgation. It is having a very large effect all over the big effect on the body. All the waste material from the body will be removed by this process. And another thing is medicated enema. So if we do the medicated enema, then the medicine will reach to the every cell of the body and it will purify the cells. This is the concept of the medicated enema. So we are giving some medicines with this. And at the complicated stage, so this is the initial and general treatment I already told you. And now especially for the neurological presentations like depression, suicidal tendency, we are advising the medicines like Jatamansi, Brahmi, Estimadu, and Guduchi, as well as the Triphala, so which is the basic drug, everyone knows about it. And these are the Latin names I mentioned about this medicines. And this is the article published in Scopus Index Journal. These are reference from. And Triphala with pomegranate juice. This is the best medicine for the copper poisoning. No oral medications like Panchagavya Ghruth. This is the medicine present in the market. It contains cow milk, clarified butter from the cow milk, like buttermilk, cow urine, curd from the cow milk, and the cow dung juice. So these are the five contents. That's why it is called as a Panchagavya Ghruth. It comes from the cow, so it's called as a Gavya. And this not only helps in the Wilson disease related to neurological presentation, but all types of neurological disorders, especially epilepsy and like that. And in my 20 years of practice, I'm using this Panchagavya Ghruth and reducing the dose of the anti-epileptic medicines successfully. And sometimes I'm with the consulting with the consultation of neurologist, I am sometimes withdrawing the allopathic medicines with the consultations and keeping patient on the Panchagavya Ghruth for some days, and also we are removing stopping these medicines. Okay, so now the benefits of Panchagavya Ghruth, it is the first of all hepatoprotective, anti-epileptic, and acting on the brain. So this is the paper published in a PubMed Index journal related to Panchagavya Ghruth. So you can go for the further reading. Another thing is we are using the Unmad Gaj Kesari tablet. It is in the tablet form, and it contains these are the ingredients shown. And another important medicine I want to tell you that antidote of copper poisoning in Ayurveda. So we are giving the coriander juice along with or the decoctions of seed of the coriander, as well as a special type of rice in Ayurveda. It is called as Munivrihi rice and sugar along with the water. So it is helpful to reduce the poisoning effect of the copper. So we can also use this coriander juice. It is available everywhere, or we can make it in the home. So if we can try for the this type of homemade recipe for the Wilson's disease, then it will be helpful. And oral medicines for the tremors or speaking related issue, these are the two medicines like Mucuna pruriens and Acurus calamus. These are the two medicines may be helpful for this neurological orders. And for the all related to depression, suicidal tendency, we are doing the Sirodhara, which is having very much, just wait. This is the last slide, just okay. Yes. So Shirodhara is best for all neurological disorders. And we are using a Brahmi oil, which is available in the market. And also some other medicines like Jatamansi and along with this medicated purgation, medicated enema, these both panchakarmas are also useful. So best medicine is or best panchakarma, I would suggest that is the Shirodhara with the Brahmi oil. So this is that's my side. Thank you for invitations once again.
Thank you, sir. Sir, what is role of yoga in such kind of
Yes, yes. Role of yoga, especially pranayam, is useful to wash out all the toxins from the body. So anulom vilom is the pranayam, especially, as well as different type of asanas, shirshasana and simple asana techniques will be beneficial. Especially pranayam is very useful.
Okay. And is there any research article to show that some kind of drugs are helpful to eliminate copper and heavy metals from body?
Yeah, right now there is no article, but we can find the references in our text, like
Okay.
coriander juice, and these are the I took from the text.
Okay. Thank you, sir.
Yes.
Thank you so much for detailed presentation. And next is Dr. Santosh Kumar Gite. He is HOD and Associate Professor of FMT Department from Ananya College of Homeopathic, Gujarat. And he is having more than 15 years teaching experience. Welcome, sir.
Thank you, ma'am, for inviting me. Uh, right now, from 2 months, I am at here in Ananya College. I am teacher from MHS.
Sir, can you
For
please, uh,
I'm audible, ma'am.
no, you are audible, sir, but cannot see you.
Okay. Yes, ma'am.
Yeah.
Uh,
You are
right now, since 2 months only, I am here in Gujarat. I was practicing at Ahmednagar, Maharashtra only. And as a homeopath, I got a chance to treat Wilson disease. I saw 5 cases only till, and the cases after referring by allopathic or neurophysicians to us for homeopathy in last stages. One case I will share with you. There was a one girl of 17 years. Suddenly, she started slow thinking and loss of memory. And that girl was very clever girl, but they took treatment somewhere else, and after that, that neurophysician diagnosed her as a Wilson disease. And after that, when she came to me, she was with only migraine symptoms, classical migraine symptoms with diagnosed as Wilson disease. But in the diagnosis, there was a golden ring was present near the cornea only. That only symptom was there in that case. And when she came to me, after 2 to 3 follow-ups, that girl attempted suicide. The suicidal symptoms are very common in Wilson diseases. And if you see homeopathic approach in such cases, we divide such cases into 3 categories. Matlab disease of any kind: sora, psychosis, and syphilis. There are 3 categories we see in every disease. If that disease is in functional in nature, then we call it as sora. If it has much more than functions, if structure is involving, and if that disease is becoming chronic, then we call it as a psychosis. And if there are degenerative changes, if there is total destruction or any faulty organic alteration in the body, either interior or exterior, then we call it as a syphilis. And most of the time, such neurological cases comes under syphilitic miasm. As in Ayurveda, you call it as a dosha, we call miasms. Miasms are very similar to your Raja, Sama, Tattva, Gun, and 3 doshas. And in homeopathy, we have our concept is that only body is not involved in such type of diseases. Initially mind is involved, and when if mind is present, then and then only the such type of diseases will occur on the body. The root cause lies in the mind. So mind has much a great role to treat such type of diseases. And so history taking and the mental symptoms gathering is a task of every homeopathic physician. So in each and every disease, we have a habit to take mental symptoms. Without mental symptoms, we cannot treat. By knowing the diagnosis only or by knowing the body symptoms only, we cannot treat. We should require, or we require mental symptoms for such type of diseases. And unfortunately, we didn't get, or I didn't get mental symptoms in such cases, because suicidal attempt or a hallucination delusions are the symptoms of disease only, that are not the symptoms of mind. Symptoms of mind means some normal and abnormal psychology. In only one case, I got one symptom that, sir, I am influenced under someone. That was the only mental symptom of that patient and not the symptom of that disease. And till now, I gave medicines as an add-on therapy with allopathic medicines to the patients, because all the patients were referred to me from the allopaths, and parents and the patients were not ready to stop allopathic medicines. So, rightly, I cannot say that only homeopathic medicine is beneficial. Homeopathy is a much better add-on therapy for the Wilson diseases. Most of the time, there are limitations also. If liver is much more involved, if there is one patient, I saw one lady was there with non-alcoholic liver cirrhosis, and that lady left treatment for the transplantation. If there is much more psychosis developed, then parents are not ready to take homeopathy. They usually prefer hospitalization. Or if there are complications like kidney failure, acute kidney failure, then we have some limitations. Yet I treated 5 cases only. In that, one patient left and another patient attempted suicide. Holistic and individualistic approach is there in homeopathy. For each and every patient, the remedy will, or the medicine will not be the same. There are medicines like Noxomica. Noxomica is from Kuchila seed. Then Lacasis. Lacasis from snake poison, cobra poison. Then there is Hyoscyamus. Then there is Belladonna. Such type of medicines are commonly used for such type of cases. But let me tell you, there is not a concept like the group of medicine is useful for Wilson disease. For each and every patient, we require mental symptoms, and individually the medicine will be different for each and every case. Thank you, ma'am.
Thank you so much, sir. Actually, suicidal attempt in Wilson's disease is a rare case, but you are lucky. You have treated 5 cases of
Yes,
such
ma'am.
time. So thank you so much. Now, is there any question from participants or Dr. Mansi? Yes, Dr. Mansi.
Yeah, ma'am, I have a question for Santosh Kumar, sir.
Okay.
Sir, the cases you treated, were the suicides they attempted, were they in after the patients went into depression or in response to hallucinations?
No, ma'am. When she came to me, her presentation was a classical migraine only, and she was already diagnosed as Wilson disease. But after a second follow-up, I got a news that she attempted a suicide.
So there were no neuropsychiatric symptoms in that case?
No, only loss of memory and slow thinking. Two symptoms were there only.
And ring.
As,
I think.
as she was taking treatment from neurophysician, when she was in my clinic, neurological symptoms were not there.
Thank you, sir.
Yes.
Any another question? Okay. So can we stop here?
Yes, I want to say thank you to Carle madam.
Thank you so much, sir, for your participation. It was so helpful, and we required it. Please send us your PPTs.
Yes, sure, ma'am. Yes, thank you.
Thank you so
Thank
much,
you.
Dr. Mansi. Dr.
Thank you.
Nina is not there due to some emergency case. Dr. Digambar Dipankar, thank you so much, sir. And Dr. Santosh Kumar Gite. Thanks. Thank you. All participants, Dr. Swanand Shukla is here. Thank you, sir. Yeah.
Thank you, ma'am.